Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM, 95.5 FM. You also find us online at foxnewskoan.com. That's foxnewskoan.com. Our phone number here at the station is 522-1020. It's 522-1020. Questions, comments about your health, comments about medicine. That's what we're here for, is a live call and show. Your calls are welcomed. However, I do have plenty on my own to talk about, and let's discuss that here in a few minutes. Some reminders, of course, you'll find me during the week at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. That's 563-2366. We have a website. Our website address is drellenburg.com, and that's DR, and then Ellenburg, Ellenburg with U.com. List of our services. List of websites you might find out more information out in the environment that affects your health, even in your home that affects your health. Good site there. Also reminders, too, on vitamindcouncil.com. It's on the site as well for a link to that. Great information on vitamin D and why it's so important for you, especially in Alaska. We also find archived radio shows on our site as well. Again, it's drellenburg.com. Check it out. I do see patients in the Kenai and Palmer areas, typically monthly. For times and days, give our office a call at 563-2366. All right, well, let's see what's going on today. We're going to have a couple of topics on cancer. As I mentioned before a few weeks ago, we're just making a weekly thing here on the radio show to talk about cancer. We'll talk about fish oil today as well, talking about magnesium and its importance for heart health. Talk about what you can find in dust in your home, what's on your chairs. There's been a lot of articles on the flame retardants sprayed on furniture, and we'll talk about that today as well. Talk about good old high-fructose corn syrup, and we'll get into talking about different contaminants that may be crossing the barrier and ending up in children, in this case, the placental barrier when women are pregnant, and what are the things that are actually happening with that. So 2 things here today on cancer. Let's get going with that right away. And again, questions, comments. I don't mind taking a break and talking to you about your questions or comments on medicine. Again, it's 522-1020. It's 522-1020. All right, here we go. Well, there was a very interesting article that appeared in the New England Journal of Medicine this month, actually just last week, actually, with the title, Study 1.3 Million Overdiagnosed Breast Cancers in 30 Years. And this has caused quite a bit of a hubbub. And first of all, I will say right off the bat that I am not suggesting anybody out there not get a mammogram, okay? However, I have presented information over the years that I've been on the radio in discussions what are some drawbacks to mammograms and what are some side effects of mammograms, because it is radiation. It is ionizing radiation, and just so you know, ionizing radiation of any type can increase your risk of cancer. The amount of ionizing radiation used in mammograms, yes, is small. However, it's being used on very sensitive hormone tissue called the breast. And so there are concerns about that. And one of the biggest things this article is trying to get into is looking at how many women are being overdiagnosed, because we're starting to find a lot of different types, not that many different types, but other types of breast cancers that the suggestion is they wouldn't have been a problem in the first place if they hadn't been found. And what that's leading to is a big increase in women being treated for those, because when you find it, you better be treating it and doing something with it. However, the discussion is we're finding too many breast cancers that would never have been a problem in the first place, and therefore over-treatments taking place and side effects from treatment and all those sort of things that get involved in that. But, just for a part of this article, we'll go through bits and pieces of it. It says, for example, in 2008 alone, breast cancer was overdiagnosed in an estimated 70,000 plus women, which was about 30% of all breast cancers diagnosed that year. So roughly for 2008, you had that's 30% of all, so that's times 3. So around 200,000 or more breast cancers are diagnosed yearly in women. And by the way, they do happen in men too. It's rare, but it can happen. Men can get breast cancer. But this article covers a huge timeline of data starting in 1976 to 2008, and looks at the number of occurrences of cancer. And over that time period, they say the incidence, which is the occurrence of breast cancer, per 100,000 women increased from 112 to 234 cases, which basically is almost exactly it doubled over that time period. The suggestion being that we're finding most of those through the mammograms that are being done, and the question again being, are we over-treating for cancers that won't be a problem? There are definitely some big critics against this article. I think what's important, too, is to realize what are some other ways, and I think it's what I mostly want to highlight is, what are some ways we could be looking at breast tissue that wouldn't involve ionizing radiation like this currently used in a mammogram? Well, you have something called a breast MRI, or magnetic resonance imaging. MRIs use a magnetic energy to look at tissue. And as far as we're aware of currently, for the most part, that has a very, very low risk, if any risk of all, of cancer. Breast MRIs are expensive. That's why they're not used more often like they should be, to be honest. And there have been a couple articles over the last 2 or 3 years that have pointed out that breast MRIs might be actually a better choice than mammograms themselves because they don't require squashing the tissue. I mean, none of us guys have ever had a mammogram, probably anybody out there, but, you're basically taking, a mammogram takes a woman's breast and pretty much squashes it, quite a bit of pressure on it, and it hurts. And doesn't feel very good. So it's a better way of doing it. It gets better imaging and no radiation. That'd be great. So a breast MRI is an option. Ultrasounds are typically only done when something's found abnormal in breast tissue. It's an add-on test. Someone had a breast MRI, or if somebody had a mammogram, then they do ultrasound afterwards, possibly to look at the tissue further if there's an abnormality found on the imaging study. The other thing out there, which is not anything like any of these imaging techniques, is something called thermography. Now, thermography does not show you literally inside the breast. It measures the temperatures. And breast thermography has been around, I think it's at least 20 years. And there are some people actually in Alaska who do that, as far as practitioners that are available to do breast thermography. And it's non-invasive. It's basically an infrared camera is looking at the woman when she's having the test done and looking for heat-sensitive areas. And the suggestion from thermography research out there is that when you tend to see an area in the breast that has a lot of a higher temperature, or higher, in this case, we're going to say a higher metabolic rate in that area, that might be an area of concern. This does not diagnose breast cancer. Do not consider this an alternative to doing mammograms or doing a breast MRI. They don't do anything like any of those. But a breast thermography could be an interesting to be having done, especially in somebody who may have had a mammogram at some point in time that was normal and got imaged again a couple of times over, is to say, well, maybe we need to look at the actual health of the breast over long term and try and prevent cancer. So I really think that thermography does have a place, not so much in diagnosis of breast cancer, but in the prevention of it. So check that out, breast thermography. Okay, folks, can you turn today? This is Dr. Michael Ellenburg. It's our show here on Fox News Talk 1020 AM, 95.5 FM. You also find us online at foxnewsKOAN.com. If you got questions about your health, give me a call here today if you'd like. It's 522-1020. That's 522-1020. All right, and one more article here today on cancer I want to address that isn't talked about a lot, and that is anybody out there who's a cancer survivor may have experienced chemo brain, as it's called, literally chemotherapy causing brain fog. And the reason that can happen is chemotherapeutic drugs work on very fast. Most of the drugs out there for chemotherapy are targeting certain parts of DNA, or as far as not DNA, excuse me, of division and cell division. And so you're going to affect a lot of areas in the body that have a high turnover rate of cells that grow fast. For example, like the gastrointestinal tract, like the bone marrow, and the brain, for example. And what's interesting in this study, and we're just study up here on, actually was at a meeting, the annual meeting of Radiological Society of North America last month, looked at the number of people in a particular study in this case and actually did a brain scan. And so what was done for this study is they looked at 128 patients who had undergone chemotherapy for breast cancer, and they used what's called a PET-CT. PET stands for positron emission tomography. And, of course, computed tomography, what CT stands for. So a PET-CT came down on the brain to look for at various things. It is used a lot of times by oncologists, that is, to look at cancer in the body. In fact, it's one of those things where, reminding people out there that, yes, sugar does feed tumors. That's what's used in a PET-CT. A patient is given a radioactive glucose agent intravenously, and then they image the patient. And wherever there may be fast-growing cells that use a lot of glucose, which is tumors or tumor, you can measure the uptake of that agent into the tumors and assess it and where things are at. They don't find every bit of cancer in the body, and typically if I think their limitations are down to about 2 millimeters, which is pretty small. But below that, you wouldn't be able to use the PET-CT to typically find any type of tumors that may be taking the rate of glucose up into themselves. But a PET-CT can also be used on the brain. In this case, they used this in the study, and they actually saw changes within the brain. And, for example, the PET-CT results demonstrated there were significant decreases in regional areas of the brain concerning metabolism. That means how it's making energy, how it's creating energy. And that were clearly, as I said, associated with symptoms of chemo-brain phenomenon. And basically, you have areas being affected in the brain. They're making less energy, and that's going to could cause a variety of type of cognition or ability to think or memory for a lot of things. And I see it in a number of patients. We see a lot of patients who are receiving chemotherapy, and chemo brain is common. I mean, I would say 3 out of 4 patients are going to have it. Now, the reality comes down to, what can you do about it? Well, while you're getting chemotherapy, there isn't particularly a whole lot you can do about it, other than the fact that you can make sure your body has a good means of detoxifying. And we certainly, when we see our cancer patients, we definitely have them take a variety of different herbs and even a variety of different minerals and vitamins, for that matter. That a couple of things. One, we're after supporting their immune system. And 2, we want to help their body detoxify. Some very good nutrients for detoxification in general, not just for chemotherapy, are things like glutathione, which you can get. The problem with glutathione, which I want to mention because it's on the radar a bit more these days, is it's not the best to take glutathione orally as a typical, like a tablet. It's not well absorbed, and so a lot of companies now are really wrapping glutathione in type of a fat-soluble substance that enhances its absorption. That's a better way to be taking that. Also a huge fan of something called milk thistle. That is very good for liver health, also good for prostate health, as a matter of fact. And turmeric, another really good, nice herb that has anti-cancer properties. It's good for your gastrointestinal tract. It's good for your liver, and it's good detoxification as well. And it's anti-inflammatory, so all kinds of nice effects with turmeric. Those things would be helpful in patients who are receiving chemotherapy to kind of help them detoxify to some degree. And that's just a few things. I mean, there's a whole host of things a person could consider to do. And outside of those things, how about some food choices? Well, dark green leafy vegetables. And I don't mean lettuce. I mean things like kale and broccoli and spinach that are really great for liver health. And, of course, you want to eat those things organically, right? A lot of vegetables have a high amount of pesticides sprayed on them. And again, some reminders, too, you can always visit the site Environmental Working Group, or EWG.org, and look at the Dirty Dozen, they call it, but it's more than just that. That's discussing, if you can't buy organic, what are the least pesticide-laden vegetables and fruits. It's free. Check it out. It's worth looking at. And if you like to eat vegetables, and I hope you do, you want to eat ones that aren't going to, make you more toxic. Let's put it that way. Also with chemo brain, and we do have been selling some at our practice for a while. We haven't used it for this, but I read an article on it recently called Prevagen. So Prevagen is an extract of jellyfish called aquavorin that can increase the amount of calcium-binding proteins in the brain. And the one clinical study that came out from Quincy Biosciences, who makes Prevagen, was positive in the favor for people who experience chemo brain by taking Prevagen. We're not quite sure how that's coming into play with helping that out, but it seems to help as well. So something directly for the brain. All right, folks. Again, this is Dr. Michael Ellenburg. If you're tuning in today, this is our medical show here on Fox News Talk 1020 AM. You also find us on FM at 95.5 and online at foxnewskoan.com. That's foxnewskoan.com. You can live stream us if you're not getting a good reception somewhere. And, of course, calls or questions about your health, that's what we're here for as well. Give me a call. It's 522-1020. It's 522-1020. Okay. Well, let's talk a little bit more about in the direction here of fish oil. As you know, there was a recent study that pretty much, just beat up and said, well, taking fish oil for cardiovascular health isn't going to do a whole lot for you. In fact, you're probably wasting your time. And what has kind of come out of that talk is the reality is that people usually who are going to be taking fish oil for any kind of cardiovascular effects are going to be people who are probably already taking, for example, different prescription drugs for high blood pressure. They could be taking a drug for decrease their levels of cholesterol, for example. So taking medications and then get on a supplement. And so a lot of people in this recent study, it's called a meta-analysis. What that is, they look at a bunch of studies together and look at the data pulled together and see as a totality whether there are changes in cardiovascular health for patients. And they were minimal in these particular studies that they kind of lumped together in what's called a meta-analysis. And they were minimal, and we're getting back to reading some of the data, minimal because most patients who were in the study were on medications. So if they're being treated and the medications are being effective, what parameters then are going to improve with taking fish oil? And that was the question. And they didn't really improve to the level that we would have liked in that particular study. And the main reason, again, being that people were already on medications for heart disease. And so the Linus Pauling Institute has a recent analysis that they went through, and it's published in the Journal of Lipid Research, lipid, L-I-P-I-D, lipids like cholesterol, right, lipid research, and looking kind of sort through the data and what's been done. I mean, and there are, as I mentioned here in the article, there's hundreds of clinical trials, and some have gained a lot of attention. And there definitely are benefits from fish oil. I mean, I believe that, and I've seen that in patients with a variety of things. And one of the biggest reasons that you may get benefit taking fish oil for cardiovascular disease is the anti-inflammation, anti-inflammatory effects of fish oil. And so in fish oil you have what's called, you have two different types of omega-3 fatty acids called EPA and DHA. They're very high in the body in various areas, like the retina of your eye, for example, is very high in EPA and DHA. And I know a couple of ophthalmologists who frequently recommend patients take fish oil for their eye health. And there's some good research actually on that. So that's a good idea for that. It's also very, very high in the adrenals in humans. You also find it very high in the brain. And I use it in a lot of patients over the years who may present with depression that is not related to necessarily a physical, literally not from a physical stressor, but the fact that they're deficient in certain nutrients, and one of those in this case being fish oil. And there's been a very good book written on this probably about 7 years ago called The Omega-3 Connection by Dr. Stoll, S-T-O-L-L. Great book where he was a neuropsychiatrist who used it in treating patients with a mild to moderate bipolar disease and depression with some very good results. But it's very clear that, fish oils do have benefits for us. I mean, and the work kind of began in the 1970s with Inuits in Greenland who ate large amounts of fish and were found to have unusually low levels of cardiovascular disease. And from there, the work began. And, millions of people have taken fish oil. It can be quite effective. The inflammatory properties, anti-inflammation properties are probably the best reason why they work a lot in cardiovascular disease. They have a slight blood thinning effect at higher doses, but typically not a problem at a moderate dose. What's a moderate dose? Well, it really comes down to the type of supplement you're taking with fish oil. And the problem, if you have a bottle and you turn around, you look at it, first of all, the most important thing is look at serving size, okay? A lot of times in a lot of fish oil products, if they're a gel cap, and this is not talking about if they're a liquid, but if they're a gel cap, they'll say, well, serving size is 2 or 3, and then they'll talk about the amount of total omega-3 fatty acids found in that particular serving size, and then the amount of what I would call the active ingredients, in this case EPA and DHA. And so if it says 2 or 3, all your numbers below there need to be divided by 2 or 3, whatever the serving size is, to actually get the real amount per gel cap. And if you're taking a fish oil gel cap that is not at least 50% EPA and DHA per gel cap, then you're taking an inferior product. Okay, there are many products out there, different companies. I'm not going to tout any particular one that make a high concentrated fish oil and a gel cap. The prescription one is Laveza, which is like 70% EPA and DHA, but it's also a prescription drug and it's expensive. You don't need to spend any money on that. You can buy fish oil on your own and accomplish the same feat. And believe me, if drug companies didn't know that fish oil, didn't believe in fish oil actually working, they wouldn't have made this stuff. So it does do something in this case. And I forget how they've actually tweaked it in some form or fashion to make it into a prescription. Not sure how that part works out, but they did. So fish oil having the anti-inflammatory effect. Inflammation is, of course, a critical piece in all chronic disease, even things like cancer, for example, but diabetes, cardiovascular disease, people who have arthritis, a variety of different things where fish oil will come into play. I hear a lot from patients, well, I eat a lot of fish. Well, yeah, that's helpful, but some of the highest amounts of the actual oil are found in the skin, which most people are not eating skin from salmon most of the time. So remember that part, that just because you're eating lots of fish doesn't mean you have high levels of high levels of EPA and DHA in your body. You can do some studies these days that exist, blood tests, and give you a great idea of your levels of omega-3 and omega-6 fatty acids, which is great if you're suffering from a chronic problem. That would be helped by taking fish oil. That would certainly improve things. Other areas that have shown some help with fish oil, as I mentioned already, eye health, in this case, visual acuity, and also improving cognitive function in patients, memory, reducing dementia, probably because of the effect on inflammation, and also such as certain types of cancers have also been shown to possibly help, specifically colon cancer. Although I would suggest that most cancers might have some benefit by people taking fish oil. Again, you would take it from a company who actually measures the amount of contaminants found in them. And a lot of times fish oils are sourced from things like anchovies or sardines, for example, because they don't live very long. They don't bioaccumulate a lot of junk and garbage from the oceans, where you certainly never want to consume something like halibut oil. Would be a bad choice, by the way. Because live for a long time. They bioaccumulate a lot of things from the oceans, like mercury and lead and PCBs, also known as polychlorinated biphenyls, which are rampant in the ocean. You find them very often. A lot of marine animals are very high in PCBs. So it's important to have a company that you can trust. So our company we do use is a company called Pharmex. I'm a big fan, too, of Carlson's. Is another good company out there. Nordic Naturals, another really good company, makes good fish oil. So there's quite a few good companies that you can choose from to look at. All right, we got about a minute. Is that about right? To the minute and a half, 2 minutes here at the end of our break. Let's see what we can get into just for a short piece. There's another article here we'll just quickly talk about here on omega-3 fatty acids and obesity. And so what they found is that in a case control study, so they had 160 severely obese patients, and they found that if they were low in omega-3 fatty acids and had higher omega-6 fatty acids in their diet, they had quite high levels of something called homocysteine, which is something we measure in a lot of our cardiovascular patients, because homocysteine is made by your body, and if it's not broken down properly, it can accumulate at higher levels and begin to cause damage, and it can actually damage your arteries and then increase plaque formation in your body. And homocysteine has been shown to be decreased by taking good amounts of vitamin B12, B6, and folate, not folic acid, but folate, active folic acid. And now we have another study pointing to the fact that fish oil could be added to that regimen and help people with their high levels of homocysteine. And as a blood test that can be commonly done, if you have cardiovascular disease and never been checked for homocysteine, I'd recommend it. If you have been checked for it and you're wondering why, well, there's no drugs to lower it. That's why most people aren't checked for it, unfortunately. So that's not good. Other ones, too, that I like to add to the list besides homocysteine are fibrinogen. It's a marker for clotting. We also are big fans looking at lipoprotein a, or another good lipid measurement. All right, folks, that's a sign we're going to our bottom of the hour break. We'll be back in a few minutes. Hold on.
Flowing out like endless rain into a paper cup, they slither wildly as they slip away across the universe. Pools of sorrow, waves of joy are drifting through my opened mind, possessing and caressing me. Being beat up and battered around, being sent up and I've been shut down. You're the best thing that I've ever found.
Hi there, folks. This is Dr. Welcome back to our show here on Fox News Talk 1020, 95.5 FM as well. If you got calls about your health or questions about your health, give me a call here at 522-1020. It's 522-1020. All right, well, let's get into this second part of today's show here. So talk about a little nasty substance known as high-fructose corn syrup. And what is that? Well, it's found in all kinds of things. It's found in ketchup. It's found in soda pops. It's found in all kinds of foods. It's found in lots of different types of bread. If you go to the local grocery store here in the Anchorage area, you'd be hard-pressed to find bread that does not have high fructose corn syrup in it. There is some there. You got to search for it. But it's in lots of breads. And what's the problem with it? Well, it came out in the 70s. And it basically has been around long enough that we see these different studies that come out talking about it in some very negative ways, which I certainly would agree with is a negative thing to be consuming. It's highly refined, so that means your body will use it pretty quickly, and it does big-time havoc on your blood sugar, big time, increasing blood sugars and increasing probably your risk of getting diabetes. I remember seeing a presentation on high-fructose corn syrup in 2006 at a conference, and this doctor was talking about the comparisons when it came on the market and then the rise in diabetes. And I don't know if it's just, that's the only thing that made it happen, but it's certainly an interesting chart where you have this dramatic introduction of high-fructose corn syrup and a dramatic increase over the next 25, 30 years of type 2 diabetes. Pretty crazy. Well, an article appeared in what's called Global Health. And in this study, researchers compared the average availability of high-fructose corn syrup to the rates of diabetes. Here you go, in 43 countries. And about half of the countries in the study had little or no high-fructose corn syrup in their food supply. So that's great. In the other 20 countries, high-fructose corn syrup in foods range from about a pound a year per person in Germany to, listen to this, to 55 pounds per year in the United States. God, that's amazing. 55 pounds the average American consumes of high-fructose corn syrup yearly. That's a lot. That's like a big, giant backpack you don't see, right? Well, one, it's going to play a lot of havoc on your blood sugar. And two, a couple years ago, a different conference, another provider presented research information demonstrating that high-fructose corn syrup might actually contain mercury. And you're saying, well, how is that possible? Well, is it from the corn itself directly? No, it's not. Now, not all high-fructose corn syrup in the U.S. is made from what's called chloralkali, but a fair amount is. And those companies that use chloralkali to make high-fructose corn syrup, mercury is contained in chloralkali. And so you end up with mercury in a lot of high-fructose corn syrup type products. It's kind of surprising, actually. I heard that when I was like, wow, you tend to wonder sometimes. I do a lot of work with patients in trying to look at, do they have, high amounts of heavy metals in the body, such as lead and mercury. And one of the biggest questions always is, what are people's exposures to these various things? And so you can do a blood test, you can do a urinary analysis, and see if anybody's got any active amount, of current mercury. So if you see mercury in the urine on a random test or even on a blood test, that means your exposure to that's been in private the last 45 to 60 days. If you found no mercury in your blood on a blood test, that does not mean there's not mercury in your body. That means it's already inside your tissues, and it distributes in all tissues in the body. Mercury does. But we'll get these things back and look at some of the numbers that come up, and it made me start to wonder even a few years ago, well, if somebody doesn't eat a whole lot of, fish, and they don't have any mercury fillings in their mouth, old amalgams in their mouth, that's also exposure to mercury. Why they're in your mouth the whole time, not just because they wear out, the mercury's still there. It's going out slowly but surely. Is it coming from food they're eating? And it certainly could be. In this case, high fructose corn syrup. So that's some of the ins and outs of why it's a really, really nasty thing to be had. And you have some of the spin on trying to create, as you say, the industry response to this is that, high fructose corn syrup is not much different than fructose. Well, fructose is a type of sugar found in fruits, but it's found in fruits where it's bound with fiber and other of the fruit matter. So it's not overly available as someone who's consuming, say, a soda pop with high fructose corn syrup. We're going to get a big whack of that fructose available right now. So it's a lot more complicated than what the spin doctors try and suggest on this. So, bottom line is, I would recommend eliminating high fructose corn syrup from your whole diet in any form or fashion. And there's no health benefits whatsoever and only negatives to it. And, it's going to be around for a long time. A lot of processed foods out there. A lot of folks eat processed food. It's going to be in it. So just remember that it increases your risk of getting diabetes. So a good reason to stop drinking those soda pops, and save them for an occasional treat instead of using it all the time. I mean, even look at what Coke. There's like classic Coke now. You can go buy a Coca-Cola and it's got real sugar in it now, right? Even I think Heinz is the same thing. They have like simple ketchup, as they call it, which doesn't have any high fructose corn syrup. It has regular cane sugar in it. So there's obviously enough of this going on that people are starting to move that with some of the products. But again, highly processed foods, both of those things. Not really a food, I guess, soda pop, but more like this is a soft drink. Okay, well, let's look forward here today. What else we got going on with some topics? Let's look at a good article looking at low serum magnesium being linked with what's called atrial fibrillation. As you know, I'm a huge fan of magnesium. Has over 300 different reactions in the body that we're currently aware of that's involved in. I mean, it's used a lot, and a lot of people are deficient in magnesium because of the fact the body uses it for so many different things. And the RDA from magnesium is about 350 milligrams. Most folks get probably about a fraction of that daily. It's high in dark green leafy vegetables. It's high in certain nuts. Some of the bigger areas of how you're going to get that as far as your food directly other than taking a supplement. And a recent study that appeared in the Journal of Circulation is a new analysis of what's called the Framingham Offspring Study. And in this particular part, the over 20-year follow-up, they looked at 3,530 people in this particular study. And they 220 or 230 roughly of the people in the study developed what's known as atrial fibrillation, where basically in your heart you have 4 chambers. You have the right and the left atriums, and then you have the right and left ventricles. And atrial fibrillation means it's taking place literally within the atrium where you have a firing problem. Where's the problem? So in this case, this is diagnosed typically by an ECG, electrocardiogram. That can be done very simply. And also can be diagnosed by patients wearing a Holter monitor where they wear it for a period of time and it can record data over, because you may not always see atrial fibrillation right away on a test. It takes, literally a couple of seconds to do. It may be happening off and on. And the average serum level in patients in the study was around 1.88 micrograms per deciliter. Just remember the 1.88. Now, on a blood test for serum magnesium, and this is a standard blood test you can have done right today at some local lab here in town, no problem. Usually goes from anywhere between 2 at its lowest to about 3.5. The problem is it's not a good measurement. And a better measurement, in my opinion, and several other docs as well, is looking at what the magnesium content is inside red blood cells as a better measurement for magnesium in the body overall. And we actually do a RBC magnesium on our health panel for our patients that we see as for lab work to screen them for this, because I ran these serum magnesiums for several years and would hardly ever see anybody that was low. But yet you'd have people come with symptoms such as, if you're low in magnesium, how would you know? Well, a very common occurrence, people get leg cramps or cramping in their body. That can be low in, it could be magnesium, it could be low in potassium, for example. It could be something else, but that's the biggest thing it may usually be is cramping because of low magnesium. Low energy, just fatigue in general. So they're kind of like vague symptoms with magnesium deficiency. But a RBC, red blood cell magnesium, is a much better test. Well, in this particular study, even though they used serum, what they found out is, how often were people having these atrial fibrillation events in their heart. And the higher that the magnesium level went in the serum, the less occurrence that took place. Like, for example, those that were under 1.77, for example, had 80 events versus 45 of those who were over 2, for example, for magnesium. So clearly it makes a difference. And, the question that comes to bear is, well, how does magnesium play out in this fashion? Well, it seems that it may play a role in the heart's conduction system, which would affect things such as the sodium-potassium, what's called sodium-potassium ATP pump, and disrupting this system and lead to, in this case, terming myocardial excitability or atrial fibrillation. So consider that. If you suffer from AFib, I would highly recommend talking with your provider and having them at a minimum do a serum magnesium. At a best, have them do an RBC, red blood cell magnesium test, and see where you're at. Magnesium also is very helpful in patients who have high blood pressure. As a matter of fact, there's a couple of good studies that demonstrate people who get on regular doses of magnesium are able to lower their blood pressure appropriately, and that makes more sense than, say, taking something like Coreg or something like lisinopril, which are very commonly used prescription drugs for high blood pressure. So consider magnesium for those specifically, and certainly, again, getting that blood test done will give you a better idea where you're starting at and how to properly take a certain dose. Because if you're taking 50 milligrams a day in a multivitamin, you may need 5 times that amount. So be aware of that. All right, folks, this is Dr. Michael Ellenburg. Listen to our medical show here on Fox News Talk 1020 AM. Also find us on FM at 95.5 and online at foxnewskoan.com. That's foxnewskoan.com. You get questions about your health or about our show today, or medical questions, of course. Our number here is 522-1020. It's 522-1020. Okay, well, let's talk. This is a better article here, I think, today, on pollutants in this case, multiple pollutants that could harm brain development in babies and fetuses. And what I was saying earlier today in the introduction to the show, one thing a lot of us don't ever think about is what can come from mom and get into the child while the child's growing inside mom. What can get through. And, unfortunately, the placental barrier does not keep things out. It keeps a lot of things just go right through it. So whatever mom has on board, if mom's got mercury levels, that's going to be a problem. Mom's got lead, that could be a problem. Mom's got PCBs in her. Whatever chemicals she's been exposed to in her lifetime, the child's going to have some of those in them. And we know this in some of these studies being done. In fact, as you can read more about on EWG.org, Environmental Working Group, has the human toxinome study they did a while back. And I think the average amount of chemicals found in a newborn in umbilical cord blood was about 120. The average amount of chemicals found. It's amazing, isn't it? And where's it coming from? It's coming from mom. That's exactly where it's coming from. And so it becomes then to be a risk. I've always talked to a lot of women over the years, if you can plan your pregnancy, I really suggest a lot of women, you should do a good detox, maybe even a couple of times before you get ready to have a child, if you can do it that way, if you can plan it that way, to clean yourself out. Even more cleaned out, less your kid's going to get in their bodies, right? And it's a big deal because we're starting to find out that in this particular study, which appeared where? This is at Brown Research University, and we don't have, not seeing it. Okay, well, can't tell where it came from, but here it is, Environmental Research this last month. And in this study, they looked at multiple pollutants, in this case, lead, mercury, polychlorinated biphenyls, PCBs. Those are the main three they looked at in the study. And in this study, what was the amount of women they looked at? About 3,000 women were looked at in the study, aged 16 to 49. And they had participated in what's called these NHANES studies that are done every couple of years. It stands for National Health and Nutrition Examination Surveys, which look at different types of pollutants that are found in humans and look at men and women and children as well in these groups. And the survey was designed, to represent this kind of idea of a population of women. So, 135 million women of childbearing age, basically at this point in time. And they looked at, again, as I mentioned, lead levels, so blood lead levels, blood levels of mercury, and blood levels of PCBs. And, of course, what they found out is that the most prominent among them, as far as being a risk factor, was age. So as women get older, and so guys as well, the risk of increasing their amounts of blood levels of these different pollutants, in this case lead, mercury, or PCBs, grew at a high rate, where women at age 30 to 39 had 12 times greater risk than the average person, and than someone aged 16 to 19, and then those age 40 to 49 had 30 times greater the risk, increased risk of having stuff in them compared to those adolescents, 16 and age 19. Another part came on the study, which is not making us very happy to see things, is looking at lead levels. And I've discussed this on the show many times because it's an important topic to here, and that is even lead levels that are suggested to be safe can still cause problems in children and even in adults. And, for example, on a blood test, typically most labs are going to say, well, if you're under 10, you're okay. Your lead level's fine. No, it's not. We've even found a couple of studies that demonstrate that levels as low as 3 could cause cognitive problems, and lead is stored in your bones and in your brain. So it can affect mental acuity, and certainly in children who mothers might have high levels of lead, could affect the ability to learn for them. You can get it out. It's a little bit of a process to get it out, but it can be done. So that was a big piece out of this too, was the level of lead being an issue. What else we got in here that we talked about? Also, of course, fish consumption increased risk for having higher levels of mercury and PCBs, which are both found in fish. And just so you do know, remember, our salmon just don't stay in the middle of Alaska and hang out. They go places. They go out the ocean for a while. So, these are issues. Our salmon tend to have less, I think, overall compared to certain other parts of the world as far as mercury, but they still have some. So don't think that they're just, pristine, fish with no problems, nothing in them. It's there. It's just what level it's in there. And the biggest thing is the type of fish you're actually eating, Obviously, you don't eat things that are higher predatory. Things like, big giant halibut, probably won't eat big giant halibut. Tuna fish of any type is high in mercury, okay? And there's people out there I know eating tuna fish like, a couple times, 3 or 4 times a week. The EPA, even the EPA suggests don't do that. And so does the FDA. Don't suggest consuming maybe about a can of tuna every couple of weeks, and especially for kids because they're smaller. And why is the problem? Again, mercury is the issue. And tuna fish contain quite a bit of mercury. So something to think about. So if you're already eating sushi, limit your intake of tuna to a large extent. It'd be a healthy thing long term for you. As I said, mercury distributes in all tissue, so it can be very hard to get out of your body. So important to remember that. And again, this article appeared in Environmental Research. And if you ever look up, this is at the CDC. It's called National Health and Nutrition Examination Surveys, or NHANES, NHANES. It's an interesting site to see all these things we find in humans. As average population numbers, looking at all these different chemicals to varying degree of levels. And you can really begin to look at and understand that when you see a cutoff for a blood lead level of 10, it says you're okay, you'd be way above the 90th percentile for anybody, child or or woman or man, for that level. So it's a dangerous level to be at. All right. Well, we've got about 7 minutes in today's show left. If you have questions on medicine, now's the time to call. So anytime I talk to you about those, if you want, our number here is 522-1020. It's 522-1020. While we wait, we will go forward with the rest of our information for today. Let's talk about an interesting article that's been making the rounds to a lot of different sites that appeared in the journal Environmental Science and Technology, talking about flame retardants, chemicals that are found in your house, dust. Why are they even there? Well, where do you find flame retardants used? Well, they're used on most mattresses. They're used on most furniture, because they don't want those things bursting into flames if someone leaves a cigarette on them, or a flame, there's a fire in the house, that sort of thing. So those things are sprayed with a fair amount of flame retardants. There's a fair amount of flame retardants when you travel on a plane and a jet. All those seats have been sprayed down big time with that stuff when they were made, just to decrease the risk of a fire that does break out, that the whole place won't just go right up. So they're there for a reason. And the research group called Silent Spring Institute found very unsafe levels of many different types of flame retardants in the dust from a large amount of homes they examined. And this dust literally seeps out. Now, the funny part is, so back in the 1970s, we banned the use of flame retardants being used in children's pajamas. Well, that's a good thing, because it's right against your skin. It goes right into you. And that's largely the result of a researcher named Arlene Bloom. And she also was involved in a recent study, and found that 85% of sofas that were tested were treated with flame retardants, and the most common one was chemical Bloom identified years ago, known to be a carcinogen. Okay? So we're being exposed to stuff in a variety of ways. There was even an article that appeared in Environmental Health Perspectives here about a year and a half ago, talking about flame retardants being found in the wrappers of butter. And there was no mention in the study of how it even got there, but it was there at a fairly high level. So wherever it was manufactured, there's a fair amount of flame retardants in that factory, I guess. So that's a concern. Well, what does it do to you? Well, it increases your risk of cancer. It disrupts hormones in your body. It can even cause learning problems, especially that's been seen in animals and in human studies. So it's a concern. Can you get products without flame retardant? You can. I don't have that list for you. You can certainly go dig around online. You'll find some stuff. But it's something worth considering. It's, again, why it's important to really think about what you have in your home, things you're exposed to. And, we used to think that the biggest exposure to pollution was outdoor. Now we have more indoor air pollution than outdoor pollution being a problem, because the way things are manufactured and what they're made with, or what's in your food for that matter, and how it's packaged. Another good example of that. So, and of course, the American Chemistry Council, which next to Big Pharma is the second largest lobbyer to Washington, D.C. For passing bills and whatnot, they'll say, the home fires are less because, we're using flame retardants. Well, that may be the case, but the problem is we're also poisoning ourselves along the way. So I don't know how else to improve that. So maybe they find some kind of chemical that can stop fires that's not hazardous to our health. That'd make more sense, right? So anyways, an article appeared in Environmental Science and Technology last month. So interesting stuff as far as that's concerned. What else we got left here for today? What did we get to today? I think we almost covered everything today. Let's again have a little short primer. We have a few minutes left here on how do you test for heavy metals. I think it's worth understanding that. Why would you want to? Well, first of all, mercury and lead and cadmium are quite commonly found in in a lot of humans. You'd be amazed what you find in your children. I mean, my son, he's 12. I did a random urine sample on him and sent it to a lab last year. He came back with like 10 different heavy metals in his body. Where are those from? He has no mercury fillings, right? But yet there's mercury in his body and lead. Low levels, but it's there. So again, that's random sampling. So when you do a blood test or a urine test for heavy metals, you're looking at what the body's been exposed to, and it depends on the heavy metal, but typically anywhere between 30 to 45, at the most 60 days. Once you're past that timeline on exposure, those heavy metals are going to go into your tissues and stay there until you get them out somehow. Or everybody's means of detoxifying themselves, things they're exposed to, is different. And cadmium, for example, is a big fan of kidneys, so it affects the kidneys. Lead's a big fan of the bone and the brain. And so is mercury. This was in all tissues, not just, it goes all over the place. So if you were to get a random urine test done or a blood test came back negative, it doesn't mean you don't have mercury, for example, or lead or cadmium in your body. It just means it's probably sequestered in some of the compartments in your body. And so the next task then is, how do you provoke the system? So you can do what's called a provoked urinary challenge test, where patients are given either IV or orally agents that are known chelators. That means a chelator means something that binds, can bind a heavy metal. For example, like DMSA is a very common oral chelator, also known as succinic acid. DMSA binds mercury and lead very well, but not cadmium very well. Mercury and lead it binds quite well. And then a patient will consume a certain amount of that or a certain period of time and then collect their urine over a 24-hour period or a set period of time. And what you're doing there is you're provoking the system to dump metals. You're binding that up with an agent that can be measured in the urine and it's called a urine challenge test, and get a better idea what's inside people. I work with a lot of people who have been involved in, say, heavy pipe cutting, for example, or welders, and these folks tend to typically have a fair amount of heavy metals in them in the first place, lots of them, especially if they've been around doing it for a long time. So it's a big concern. And then one of the better sites online to learn more about this as well for testing is called Doctors Data, doctor spelled out, doctorsdata.com. Check it out. Well, folks, that's time to wrap things up today. Again, some reminders, and we can find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. And, of course, we're here on Mondays from 2 to 3 p.m. Have a great week, and we'll talk to you next Monday.
A folded hand, a poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No milk.